Hi, I'm Bons Magsambal, and this is Rappler Talk. Aside from the COVID-19 pandemic, the Philippines is also facing another health crisis that has not been contained up until now. How is the HIV epidemic in the country? Joining us today is Winnie Bayanima, Executive Director of the Joint United Nations Program on HIV and AIDS. To start off our discussion, how is the situation of the HIV epidemic in the Philippines? Are we seeing a downward trend of cases due to mobility restrictions or not?
Oh, the simple answer there is no. We are not seeing reductions in new HIV infections. We're seeing the opposite. The Philippines has one of the fastest growing HIV epidemics in the world. And in fact, in Asia and Pacific, it has the fastest growing epidemic. This epidemic has been, it's small for the moment, but it is growing very fast. In the last 10 years, new infections have grown by 237%. And AIDS-related deaths in the last 10 years have grown by 450%. So you're talking of an epidemic that is growing very fast. And even before COVID, Philippines had missed achieving the global targets for last year, 2020. We had these targets for treatment, testing and treatment, where the world was supposed to reach 90% of all the people with HIV were supposed to know their status. And 90% of those who know their status living with HIV were supposed to be on treatment. And then 90% of those on treatment were supposed to be virally suppressed, meaning that it's undetectable and they can't transmit. But Philippines fell very short of those targets. By last year, Philippines had only 70% of people with HIV who knew their status, not 90. And Philippines had only 43% of those who are HIV on treatment, less than a half, meaning that there's a whole half who are not on treatment, who are probably spreading the virus and who are going to get ill and die. So Philippines has an important job to do, especially now that COVID has come and also disrupted the services which exist. We know that, for example, testing dropped in the first phase of COVID by 60%, people coming forward to be tested. We are also seeing that people on treatment also dropped. The people coming on treatment, the numbers also dropped. So we also saw that because of the pandemic, people were not moving easily to access services. And and also the service providers themselves were taken away to fight COVID. So all this needs to be addressed to get back on track.
Okay, right. So does UNAIDS have updated statistics of the HIV situation in the Philippines? How many are infected in the country now? And then to follow that up, in terms of cases, how does the Philippines fare compared to other countries?
Yes, we work with the government to keep track on the epidemic. We have UNAIDS is really the source of information about HIV for the whole world, for every country, for the whole world. And we work with government to collect that data. So we know what's happening. For example, we know that as of last year, there was a total of 114 100,014. Yeah, wait a moment. How do you say this? 100 111,400 estimated people living with HIV. 111,400. Out of that number, less than a half, as I've said, were on treatment, on antiretroviral therapy. That's not good. We can push that up and make sure that all of them are on treatment and are virally suppressed. There are many factors, as I've said, why people are not on treatment. Services were disrupted, yes, but also there's stigma and discrimination, because most of these people are young, and young people are very sensitive about discrimination and stigma. If services don't reach them in ways that protect their privacy and allow them to feel respected, then they don't show up. So stigma and discrimination is one of the problems, but also the fact that services are fewer and not delivered in the best way for all the groups. These are some of the factors. If I can share with you some more data, we know, for example, that in this region of Asia, there are 7 countries that are having a rising HIV epidemic. So it's not only Philippines. We also know that Malaysia, Papua New Guinea, Pakistan, Fiji, Afghanistan, Timor-Leste, together with Philippines, have rising epidemics. But in other parts of the world, which have a high epidemic, we are seeing them fighting hard and it is decreasing. So it doesn't have to be that way. There are countries that are making very big, huge progress against the epidemic, and Philippines also can. The country is committed. We know the government is, it knows what needs to be done, and it had achieved good results in the early years of the epidemic, so it can do it again.
Okay. Just a follow up on that, Ms. Winnie. I'm just wondering, how does the Philippines fare compared to other countries in terms of HIV infection?
This is what I've just said to you, that in this region, Asia and the Pacific, it is the country with the fastest growing epidemic. So you're not doing well in this region. And globally, you're also still ranked among the highest growing epidemics. So you're not doing, Philippines isn't doing well. And that's why I'm visiting Philippines, because I know that Philippines can control this epidemic if it does the right things like it used to. But now I think 40 years on, there has been some relaxing, if I can call it so, but also other problems, now COVID, that are in the way. So we are here to support as the UN. We are here to show the evidence of what works and to get Philippines to control this epidemic.
Okay. Yeah, you mentioned earlier that even with the pandemic, HIV infections in the Philippines are on the rise. What do you think contributed to the rise in cases?
There are a number of factors. For example, during COVID, people had restricted movements. They were not moving much. So the HIV services which were there were not being accessed because people were fearing to move to get infected. But also the services themselves were disrupted. Prevention, testing, treatment services were disrupted as the country struggled to fight yet another pandemic. So these services, now we need to find smart ways, innovative ways to share the services so that this disease is not, we don't drop the ball on this disease while we are fighting another one. So that was one of the reasons. For example, HIV prevention dropped by 10%. So that's one of the reasons. Also, we saw that we see there are things that we have learned through COVID that are positive that we can do to make sure that we fight both diseases and succeed. For example, young people are always on digital platforms. Using digital platforms and using digital technology to campaign, to take the message out to young people works. So online campaigns, raising awareness, and even delivering some services through telemedicine. That is very important. We also know that other ways of servicing and making it easier were innovated, and we can continue them, like giving people their medicine for 3 months instead of 1 month. We call it multi-month dispensing. That reduces the need to keep traveling and also reduces the burden on the clinic, on staff. So multi-month dispensing, delivering at the door, and so on. All these things were innovated during the COVID pandemic. And if we consolidate them, they can help us going forward to fight HIV. But yeah, those are some of the factors. And as I mentioned, stigma and discrimination is a factor that also keeps people away.
Okay, right. So for this next question is a lot of people, especially the younger age group, are curious about this. Are people living with HIV more susceptible to getting severe COVID? Why?
No,
Why in case?
no, we don't have evidence that if you live with HIV, you are at a higher risk of catching COVID. We don't have such evidence. Or that if you are HIV and you get COVID, you will be more ill than other people. We don't have that. But I must say this, if you are HIV positive and you are not on your treatment, you might be prone to other infections that make you vulnerable to COVID. So it's so important that you do a test if you suspect that you may have contracted it, and know your status. And if you're positive, to get on your treatment and stay on the treatment. If you fall out of treatment, you could develop those illnesses that make you more vulnerable to COVID. So it's why it's important to test and to use prevention, or if you are positive, to be on treatment, because underlying health conditions can make you more vulnerable to COVID, and those conditions can come from being HIV positive. So strong message is do a test, and when you do your test and you're positive, get on treatment, stay on treatment. Another point about COVID and HIV is that we have learned from fighting HIV how to fight COVID. That's why the people who fight HIV were taken to fight COVID. But also in fighting COVID, we've learned new things which can help us move faster to end AIDS and HIV. So there are learnings from both sides, and we need to maximize on them. Like I've mentioned, the use of telemedicine, the use of digital platforms to do prevention messages, the way of servicing and multi-month dispensing, and using peer groups to support each other to deliver medicines. All these things are new now, and they can help us to fight HIV and win.
Okay, so for my next question, what do you think the government can do to prevent more HIV infections in the Philippines during the pandemic?
Well, first, the government has done two good things. One is to pass the AIDS law. This is one of the most progressive laws we have, and it focuses on human rights, which are critical. You have to put human rights of people living with HIV, people affected, at the center of any response to a pandemic. So the law is important. What government needs to do is to budget for it, put staffing on the ground for it, right down to the community level, and enable the law to be implemented. The second thing is for the government to strengthen its National AIDS Commission, because a pandemic is not just a health issue. An epidemic is a health issue, it's a social issue, it's a community issue, it's a human rights issue, it is an economic issue, it is a governance issue. You need all parts of government and society to fight and win against an epidemic. And that is done through the National AIDS Commission. It brings together many actors, including civil society, faith leaders, communities, law, social development together. It needs to be strong. So a recommendation from us is that strengthen the National AIDS Commission, put there the different actors and institutions you need to have a multi-sectoral response to HIV. That's how to win. Then thirdly, human rights, human rights, human rights. For example, people who inject drugs are not able to prevent themselves from getting HIV if they are not given an opportunity to find the needles they need, the clean needles, to avoid getting HIV. So the way we enforce the law must respect the right to health of people who inject. Otherwise, the disease can spread very fast among them and their partners. The same with the human rights of gay men who have sex with men. Sex work is criminal. Fine. Even without decriminalizing sex work, although I think it should be decriminalized, sex workers should be enabled to have their right to health, to access services and protect themselves and their partners from getting HIV. So the right to health, human rights at the center is so important. That would be my message. Strengthen the human rights of those who are affected and who are living with HIV.
Okay. You mentioned that was your message to the Philippine government. Okay, to wrap up our discussion, what is your advice to the people, especially to the younger Filipinos, to prevent HIV infection?
To young Filipinos, you want to live your full life. You want to enjoy your life and contribute to society. So prevention is important. Have safe sex. Do not take risks. Use a condom. Use PrEP if you know how to use PrEP, but there are all the tools to make you avoid getting HIV. Find out and make sure you have safe sex. And test yourself, test and see, because if you are positive, it's not a life sentence. Get on treatment. It's just one tablet every day, and you will live your life long and you will enjoy yourself, and you will not, once you are on treatment and you don't have the virus showing in your blood, you're safe, you're not transmitting, you're as good as anybody, and you can still have healthy sexual relations and have a good long life. So prevent by taking all the prevention, learn about it, test, and go on treatment if you're positive. It's not a life sentence and it's not a crime to be HIV positive. It's just another disease. That's my message to young people. Stay safe and be happy. Have safe sex and don't use violence in sexual relations. Violence transmits this disease. always accept a no as a no and a yes as a yes, and have safe sex.
Okay, thank you so much, Miss Winnie Bianima, for this fruitful discussion.